it's Scott, and I'm here this afternoon at Nemours Children's in Orlando. And we've wanted to do this Give Me Five for a while. And what this involves is when you're giving any sort of a medication. Very appropriately, you have to read the label. And that almost goes without saying. However, a little while back, one of our peds respiratory therapists took that one step further. And he said, you know what? You not only need to read the label when it comes to meds, but interestingly, when it comes to children, you also have to read the Flowmeter. Now, why this comes into play is on the big people hospital side, right? Or the community hospital ER, anywhere outside essentially the baby ICU. We've got a traditional flow meter, and traditional flow meters, remember, start at 0. You crank it up and it goes more or less to 15 liters. Not an issue. Hook it up to your Ambu bag, crank it up, and do what you need to do. However, his point was that's absolutely true, but remember that flow meters come in different sizes. That's huge. Meaning the size itself is exactly the same, but how much flow comes out is completely different. Whereas your run-of-the-mill everyday flow meter goes up to 15, this one, commonly used, especially with long-term little kids who need little amounts of oxygen, as we'll show you, starts at 0, but when you crank it up, it only goes to 1 liter. That's huge. Because if you're trying to fill an Ambu bag or something similar, you know what? You need to make sure you've got the right flow meter. So I'm just going to go ahead and hook up your regular flow meter, crank it up to 15. And as we take a look at our anesthesia bag here, you can see, to no surprise, that very appropriately it fills the bag. So that's what it looks like when you hook a regular flow meter, 15 liters more or less, to a bag. Same idea illustrated here. Whereas we go ahead and put 15 liters of flow into here, as you can imagine, we've got a whole lot of gas that's happily able to go ahead and go into your bag and hopefully out of your patient's lungs. Okay, so if that was a traditional Ambu bag, meaning hook it up, crank it up 15 liters, honestly, don't give it a second thought, do what you need to do. The difference is if we take our little 1 liter flow meter and I were to crank it all the way up, thinking that it's a traditional flow meter. Now, if you watch our bag, we're waiting, we're still waiting. It's nowhere near getting full and we're still waiting. Or if I were to go ahead and give 1 breath, well then, yet again, we're waiting. So now exactly the same idea here. Whereas before, you remember 15 liters, you had Mount Vesuvius going ahead and bubbling over the side. When we take our little baby flow meter and max it out, all we get is little Don Ho tiny bubbles. So with that in mind, in the event that you need to go ahead and bag either a baby, a kid, or a big person, remember it's not good enough to only read the label on the meds, but you also need to make sure to read the label on the flow meter as well.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.